Dr. Nandita Mohan, and I welcome you to Medical Dialogues, your daily dose of health and medical news. Let's look into the latest news from the medical world. Turban Triad, an entity that highlights the role of cultural factors in certain skin diseases. Sikhism is a religion of the Indian subcontinent in which cutting the scalp hair is forbidden. An article describing a new triad of symptoms and signs seen in these populations was recently published in the Indian Dermatology Online Journal. A teenage girl presented with a 3-year history of painful non-healing erythematous thickened skin over the antihelix and retroauricular folds with comedones and inflammatory papules limited to the forehead. She also had symmetrical areas of alopecia along with frontotemporal areas, along with the short hair scattered along the frontotemporal line, commonly the fringe sign. All of these features could be explained by the turban headgear she wore regularly for the last 5 years. She was diagnosed with a turban ear, acne mechanica, and traction alopecia, all stemming from tightly wrapping the turban around her head with lesions in the areas of maximum contact with the turban. Turban ear is like acanthoma fissuratum seen in spectacle wearers, a response of the facial skin to repeated trauma and friction. Repeated rubbing due to turban leads to the follicular ostia damage, which along with continuous occlusion causes hyperhydration of the skin, causing problems in resisting shear force, resulting in papules and even pustules. Traction alopecia is a non-scarring alopecia due to tight hairstyles, and this is a common disorder among Sikh patients. Management of this condition is a great challenge in these patients as the cutting of hair or even removing the turban is forbidden by the religion, especially in males. The patient was prescribed a combination of topical benzoyl peroxide and clindamycin for her acne lesions, mild topical steroids for the ears, and topical minoxidil for traction alopecia with some improvement. Since the patient was a female, she agreed to substitute her turban for a dupatta. However, this may not be an option for Sikh males. In the male Sikh patients, advice can be given to prevent the turban triad to occur. They can either tie their hair loosely in the turban, loosely wrapping the turban at the base, avoiding any pressure points with the turban, using a softer and non-starched garment for the turban, wrapping the ear with cotton wool, and avoiding wearing turban at night. In conclusion, the authors highlighted that there is a role of cultural factors in certain skin diseases, and these must be identified to avoid unnecessary investigations and treatment while facilitating preventive action.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.